Oh, it's 4 o'clock. Oh, wake up. It's time to get going.
Recording in progress.
Roll calls.
Greg,
Yeah, here.
Maggie,
Here.
Rosemary,
Here.
Ann,
Present.
and Max is excused.
Please join me in a salute to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
For as long as you want to.
Rosemary?
Here.
The reading of the mission statement.
Okay. Our goal is to anticipate and provide services to meet the healthcare needs of the people we serve.
Thank you very much, Presidents. Welcome everybody. Consent agenda, we have the regular minutes of the meeting of the 29th of August, and we have the regular meeting of September 23rd. Are there any corrections or additions to the minutes as mailed?
On September 23rd minute, was there a copy of what your presentation?
They were just my notes.
Oh, okay. I
Okay?
didn't know if those should have been included.
They were just my notes.
Okay.
Okay?
Right. I'll make a
Anything else?
motion to approve them then.
Okay, a motion on the floor to approve the minutes.
I second.
Okay, we have a motion and a second. Roll call.
Greg,
Yes.
Maggie,
Yes.
Rosemary,
Abstained, I was absent.
and Ann.
Okay, public comment. Members of the public are welcome to participate in the meetings of the board. Comments of the public will be accepted during the public comment portion of the agenda. No actions or comments will be taken by the board members on matters not on the agenda. Public comments on agenda items should be made at the time each item is considered. When the board president recognizes a member of the public for all comment, such comment shall be 3 minutes or less at the discretion of the board president. We would like to calm presentation so that the importance of what you are saying is not overshadowed by the manner of the presentation. Any public comment? None? We will close public comment and we'll go on to item 8, recognition certificate and plaque for Maggie Campa for her years and years of service.
And Maggie's son is in the crowd, everyone.
Yes,
Oh, nice.
yes, my son is,
Your mother is an asset.
She is.
thank you.
Maggie, you want to come up? Maybe if we can do it up here. And
It says, in appreciation for years of dedicated service as the board director for the Soledad Community Healthcare District, your leadership and commitment have been greatly contributed to the health and well-being of Soledad residents. We're grateful for your dedication and accessible healthcare and your role in strengthening our community. Thank you so much.
Well, thank you. Thank you so much.
on the board, but we still have one more thing, Maggie.
Oh,
Oh,
Oh
wow.
my goodness.
oh, beautiful set.
I don't know if you dare trust me with this.
It's very heavy.
Gorgeous.
So maybe you could read in honor of your vision, your leadership, and unwavering commitment to the healthcare for all, with sincere appreciation for the Soledad Community Healthcare District and the community. Thank you, Maxie.
Thank you so much,
Thank
Maggie.
you. I am eternally grateful. I appreciate this recognition. Thank you so much.
How many years were you on the board?
I want to say 20 years.
Wow.
No, Steve
Wow.
first invited me to tour the beautiful facility, so I knew then and there I wanted to be a part of it. And I've seen tremendous growth, expansion, and it's going to continue. And under Ida's leadership, her team, Draga, Sophie, so many people. Can't mention everyone, the nurses, the doctors, the therapists. We wish you continued success, and it's been an honor working with the board. I'm grateful to get to know every single one of you. So, well, it's
Can we
had to
take a
goodbye, but
picture?
we'll see you. I'll make some visits.
They
There, perfect. Ready? 1, 2, 3.
That's cute.
Wonderful.
Thank
Thank you. And then the rest of
you.
the board. Perfect. If you can- Ready? 1, 2, 3. One more. Ready? 1, 2, 3. Wonderful. Thank you so much.
Thank you, thank you, thank you again.
Yes. So we're not done with recognitions. We actually have a couple more. This is a certificate of appreciation. This certificate is presented to Rosemary Guidotti.
Or, well, that doesn't mean I'm leaving.
Do you want to come on up and I'll read it? All right. You know, you guys do such great work, and we don't do enough to recognize all of your great work that you guys have done here. So, Rosemary, in appreciation of your dedicated service as a board of director for the Soledad Community Healthcare District, your leadership has significantly contributed to the health and well-being of our community. We are grateful for your commitment to accessible healthcare. So on behalf of myself and Greg and the board, we signed up for you.
Well, thank you.
Okay?
And I don't know how many years it's been.
It's been longer than me, Rosemary.
I
You
know,
were here
a lot
before
of
me.
years, yeah.
Recording stopped.
Ready? 1, 2, 3.
How many years, Rosemary?
A lot of years. A lot of years.
This is a certificate of appreciation. This certificate is presented to Graig Stephens. In appreciation of your dedicated service as a board of director for the Soledad Community Healthcare District, your leadership has significantly contributed to the health and well-being of our community. We are grateful to you for your commitment and your access to healthcare.
Thank you so much.
Ready? 1, 2, 3. Wonderful. Thank you. Okay. You all received my report on your board packet, and in the cover you will see Ida, who is smiling because our team, our district team, decided to celebrate Boss Day, National Boss Day, which is October 16th. So you will see her smiling in the little decorations that we were able to make for her in her office. And then following over to the next page, we have on the left-hand side, we have Mrs. Judith Lynch, who was a resident here with us, and she decided to come back. This was a little bit prior to our COVID protocol. She decided to come back and visit her, she calls them like the other inmates because that's just a joke. But she decided to come visit her rest of her peers and also bring cookies to the therapy team, the front desk staff. So she's very grateful. And I actually recorded a video testimonial of her, so you'll be seeing that on social media and on YouTube shortly. And then the next picture is our groundskeeper Alfredo, who unfortunately lost his dad. And why I'm sharing this is because Manuel Ramirez was actually our former groundskeeper who passed on the job to his son Alfredo. So it's a family who has been with us for a very long time, and we are sad that they have a loss in the family. Then you will see that the Leadership Academy has gathered, but it's in a new location due to our COVID protocol. We were able to reach out to the Family Resource Center, and they were happy to offer us their conference room for us to use and keep our residents safe and for our staff to be able to gather. And we also celebrated Vanessa Dingson's birthday. And then you will see that our dear Pamela Hernandez, our social services coordinator, was honored with a certificate of appreciation by the American Legion in Gonzales for her dedication to our residents and veterans that have come to stay with us.
Ooh, that's good.
And in the following page, you'll see that Ida was there to support her as she received this award. And our students who are working towards their healthcare careers are back. They have been learning from our CNAs, our LVNs, and they're just happy to be here. And we're happy to have that partnership with HeartNow. And we also celebrated a very special birthday in October for Rosario and Rodrigo Reynoso, who not only are they mother and son, but they share the same birthday. Okay, and then you will then see that Sonia de la Rosa was visited our district and learned a little bit more about what we do. For those of you that are not aware, Sonia de la Rosa is the county administrator. And then you will also see that Ida was proudly supporting our dear Pam. And you will see the last picture that said, that has the Women's Center, the Women's Health Center, who got recognized for from the Soledad City Council for a proclamation for women's
National Breast Cancer.
National Breast Cancer Awareness. And then I have like a personal, professional report for all of you to be aware that we have a CSUMB Service Learner student who will be volunteering with us, and she will be shadowing Pam, Social Services, our Activities Director, and also our DSD, Vanessa, with just anything from arranging PPD to just being able to support our staff here while she also learns and works towards her like social services degree. Is there any questions?
I do. You know, this is really, really nice, with all the good stuff that's going on here. But I haven't seen any of this out in the media. And I haven't seen it on Instagram, I haven't seen it on any of the sites for any of the entities here. And there hasn't been much of an update.
Yeah. I do have to apologize. I was out sick.
Oh, okay.
I was out sick. I have surgery, so I came back
Oh,
a couple weeks ago. Yeah.
so there's a lot of good stuff here, so
I will catch up.
spread the word.
Yes,
Okay.
I'll make sure to.
I'm glad you're better.
Yes.
Because you do a great job.
Oh, thank you.
Okay.
And then just a continued report, we are working towards our ACHD certification, and I'm also working on the annual report, which is 80% completed on the content. We just need to start designing and make sure that it's good to go. Any questions?
Thank you very much.
Of course.
Mr. Brent?
Okay, our treasurer's report starts on page 14. I'll give you a second or two to get there. Okay. Just on an outside note, we've been contacted by the auditors, and we're starting to gather the information for not only the audit, but the cost report. So fun. So we'll be busy for a couple months getting all that together. We don't have a couple months, we have a month. So
We literally have a month from now.
so we'll get that to them in the next week or two, and then they can do their work. So the month of September, generally speaking, it was better than the month of August, but still not positive. We showed a loss of about $98,000 for the month of September. So let's go through and see where we're at. On page 14, you can see the balance sheet. You can see our current assets are $5,842,000. That's the subtotal of the first column, the first section up there, $5,842,000. What we compare that to is your current liabilities. So do you have enough in receipts and cash in order to pay everything that's due immediately? And we have $5.4 million in current liabilities. So you like a 2-to-1 ratio, but 1-to-1 is minimum, is what the banks like. Okay, they like a little more cushion than just 1-to-1.
Yeah.
But
So do we.
so do we, exactly. Okay, you can see down there below for the 3 months then ending September 30th, our decrease in net assets is a negative 29,000. So we're almost break even for the first quarter. Not quite there, but almost break even for the first quarter. Okay, now remember that the PPS, the change in the PPS took effect August 1st. So instead of having to adjust like 375,000 a quarter, it's now being reflected in here. So, except for 1 month, the month of July. We'll have to do an adjustment for the month of July, but I'll do that maybe at the 6-month interval once we have a better feeling for, and once the audit's done, we have a better feeling for the prior year as well. Okay? Page 15 is the quarter. You can look at our revenues, our medical services. We're at $5 million gross revenues compared to $5,745,000 the year before. And as we look at the individual entities, we'll look at Eden Valley and we'll look at the clinic and we'll see where that adjustment primarily lies. Our contractual adjustments, even though we're lower in revenues, our contractual adjustments are higher, but that again is a reflection of the PPS change. Okay? They're going to be reflected in there as we go. Our expenditures are lower, which is good since our revenues are lower. Not quite enough, but they're lower, so that's good. Our salaries are just slightly under from the prior year. Our professional fees are substantially lower. Once again, that's the nursing, okay? Travelers. The travelers, we had a contract the year before that was extremely high. This year, it's still high, but it's not as bad, okay? So our bottom line operating income, you always want to see that positive. So that is positive, 94,390 right in the middle of the page, first column. Okay? It's substantially lower than the year before, but remember the year before, July, August, September were some of the best months we've ever had here at the district. Then we subtract our depreciation, and so that's where we get our operating income of a negative 29,000. Our grants and contributions and interest income basically offset our interest expense.
I have a question.
Uh-huh.
Last week, Newsom passed a bill, signed the bill, for a minimum wage for healthcare people for $25 an hour. So that wouldn't be reflected yet, but how much is that going to impact us?
So I was going to speak to that in my report, but I can certainly address it now. So because of our size and our type of entity, we are actually exempt from that, Rosemary.
Oh, really? Really?
At the level of Eden and at the level of the clinic. Those, that is focused on larger organizations such as hospitals. So like me and Salinas Valley Health. However, and I was going to report this during my report. However, what happens to us because we're sandwiched in the middle of these two larger organizations that will be required to make that change, that's leaving us behind, which means is that our staff will start moving and we may start losing staff. So there was a decision made to take our existing staff and make all of their base salary $18, which is, when you look at the scales, the first one was 18, the second level was 21, and then the final one is 25. Because we don't want to be left out, and if we're too low, people are going to start moving, and as you guys know, it's very hard and difficult to hire folks to come to a rural health area. And so that was what we did, and performance evaluations were just done in this month, and everyone pretty much across the board, if they weren't new to our organization, got an increase, and those that were not at 18 got a significant increase to reach them there, so that we can at least be competitive to our, and they're not quite our peers, but to other healthcare agencies nearby.
So what about the union? Have we met with the union yet?
Not yet, and that was another pause because we are waiting on all that process to continue on, and that takes some time. But again, we decided to include anyone who participates, even in the union, to get these increases, because we don't want to be left behind
Yeah.
and they just go elsewhere because we aren't providing them a comparable salary. So everybody across the board got increases in addition to anyone who's assigned or part of the membership of the union. And everybody is now at a minimum base of $18 an hour.
And that was within the budget.
That was within the budget. Yeah. So even though we're not necessarily required to be included, we didn't want to not include ourselves and then get left behind.
We did do the calculations when we were working on the budget to see how it would affect us. So we are kind of prepared in the event that we have to go in that direction. Okay, so our bottom line then is that net increase, decrease in net assets, negative 28,000. Okay, page 16 is our cash. We have $2,857,000 in cash. Remember that a good portion of that, $1.2 million in First Capital, is sitting there waiting to pay our PPS from 2 years ago. Okay, our accounts receivable, it's been fairly consistent. We do have a possible adjustment to our clinic. I'm looking at it. There's some adjustments from the prior year that we're still resolving. So we may have another couple $100,000 in receivables, but I'm still investigating to see what that may be. Okay, so that may jump up to $500,000 to $600,000.
And there will probably be another adjustment and increase, and you're going to notice it, Brian. So there are many certifications that we must complete and recertifications on an annual basis, and one is with our Medicare. And the process took longer than expected, and it's delayed payment of those claims. We resolved that a couple of days ago with the help of the agency. They were able to get us a resolution and approval. So all of those claims that we had not been able to process are now being processed effective, so you will see an increase as a result.
Okay. Middle of the page, you have the summary of income by month. So July, good month. August, not so good. September, better than August, not as good as July. Okay, and that's all, it's pretty much all based on census. Census climbed a little bit in September from August, but still not exactly where we need it to be.
And you hear from Susan, when she gives a report, census is down at the hospitals. They've had only 80 patients in the hospital. So think about it, if they only have 80, we have a 59-bed facility.
You know, they send people home the same day, that's why.
Yeah, they have, yeah. So, there's other efforts being made now to promote and get others to know about us so that we can get folks to come here, but census is very low right now.
And the potential that with the saline solution shortage because of the supplier is in North Carolina, and it's about 60%, and they got nailed by the hurricane. And so they're going to scale back surgeries nationwide until that is resolved.
I can attest that my son is a perfusionist in Indiana, and he said that their cases dropped from 5 a day down to 1 or 2 a day. They're just not doing them because they don't have the saline.
Yeah.
And we rely on those kind of operations or whatever to happen in order for them to be here at Eden Valley. Yeah.
Okay, so on page 17 you have Eden Valley. You'll look at our revenues. So the main adjustment there in revenues from the prior year is in Medicare. And that's exactly what we were talking about. So the census is down for Medicare patients. You look at our expenditures, we're down almost equal to our revenues, and so we're managing Eden Valley really well. It's still making a profit of $465,000 compared to $540 the year before, with a drop of $354,000 in Medicare revenue. So that tells you that, and once again, you can see that drop in nursing administration.
I was gonna ask you about it, that's huge.
That is huge, and that's, you know, the professional fees that we saw
Yeah.
on the other page.
That's huge.
And then down below, it's just by types of benefits, so you can kind of see the salaries. Once again, the professional fees are down. Purchase services, which are repairs and maintenance, those type of things are down as well. Okay. Then we jump to page 18, and you can see the clinic. And you can see we have a drop of revenues at the clinic of $458,000. And our expenditures have gone down as well, but not in equal proportion as much as the Eden Valley's expenditures have gone down in proportion to the revenues. And I realize that that's a little harder to control, but you know, we have to do the best we can.
That's where you're gonna see the Medicare increase.
Yeah.
Yeah.
Okay. So we're looking at an $83,000 loss at the clinic versus a $285,000 profit for the prior year at this point. Now this bottom section is new. This is what we discussed in our meeting last week. Max in particular had asked for a summary of the expenditures of the district. So I have put that together so you can see the salaries, the professional fees. Now remember, you're looking at the salaries and why the salaries go up $82,000. Well, that's because Ida's salary last year was under Eden Valley, and this year we're putting it in the district so we can split between Eden Valley and the clinic. Okay. Okay. Summary of income by month at the top of page 19. So Eden Valley had a profit of, give me a second to get those pages apart. So Eden Valley had a profit of about $145,000. The clinic, a loss of $49,000, and then our district-wide expenditures of $149,000. So $52,000 loss for the year without depreciation, for the month, excuse me. Okay, compared to $147,000, $148,000 for the first 2 months.
And then in December, we should get property tax.
December, we get property tax, which will help the offset.
Months or menos, about how much is that?
We budget,
We can get to that when we get to the budget.
Yeah.
You can answer it then.
yeah, so it's about, oh, I've got it right here.
Oh, okay.
Just a second.
More trouble than I'm worth, I'm sorry.
No, it's fine. 434,000, so we usually get a little more than 50%, about 60% in the first go around. So probably about 250.
Okay.
Okay. And then on page, and then just a summary of the cash flows at the bottom 19. That's the end of the treasurer's report.
Any questions of the treasurer's report? Motion then to approve the treasurer's report.
I'll make a motion.
Okay, Ange made the motion. Do I have a second, anyone?
Second.
Okay, Rosemary seconds. Roll call, please.
Graig.
Yes.
Maggie.
Yes.
Rosemary.
Yes.
And Ann.
Thank you. Okay, budget review.
Okay, so the page 20 is the summary for the budget. You can look at the first column, and that's our budget year to date. So that's our budget for 3 months. And we were to have a surplus of $35,210. But that's taking the property taxes and saying we're going to get that over equally over the 6-month period. You know, so you take that out, and we're really at about a loss of a $65,000 because we know we're not going to get the property taxes until the end of December. So in reality, you know, we're looking at a loss of $65,000 on budget versus a loss of $29,000 in actual. So we're actually doing okay in comparison to the budget. We're just a lot tighter than we have been over the last year. Okay. You can look year to date, Eden Valley, we're at a. Now remember at the middle of the page there, you see under general and administrative, you see allocation of district expenditures. If you follow that across, so the district expenditures were 458 for the first quarter. We split those, 60% goes to Eden Valley, 40% goes to the clinic. We've done that just based on annual history. I just looked at our workers' comp policy audit, and it's actually 62% versus 38%, so we're still right there. Okay, so I'm not gonna make any adjustments at this point. We'll just continue to go until the auditors say, no, you need to square that up a little bit more. Okay? So, and then on page 21, you can see the budget for Eden Valley. The first column is the whole year. The second column is just for the first quarter, for the first 3 months. And then you have the 3 months actual and then the variance. So, for example, we budgeted to have $2,472,000 in revenues. We have $2,424,000. So, based on our budget numbers, even though we're $400,000 lower than last year, our budget numbers were only $48,000 off. Okay, and our expenditures were to the positive of $3,499, but once again, it's just very tight. Okay, going to the clinic. On page 22, we budgeted, once again, that second column, for the first 3 months, we budgeted 1.5 million in revenues, and we're at 1.4. So we're behind there. And if you look at our expenditures based on the budget, we're in excess of our budget. Okay? So it gives us a total of 100,000 that we're actually, oh, I'm sorry, no, we're better, 223,000. I was looking at that reverse. 223,000 to the good in our expenditures. Okay? So we're 100,000 to the good overall. So even though we're not doing as well, we're still in line with our budget. So if we can hold true to our budget, we'll still be okay in meeting the year-end goals. And then our district on page 23, we don't budget many revenues up at the top. Those are just like refunds. But our expenditures are 458. We budgeted 469, so we're 11,000 to the good there as well. So overall, we're doing really well. Not as well as we had last year, but we're still okay. And as long as the trend is, it doesn't sound like the census has improved much, but as long as we can hold steady and hopefully improve a little bit in that regard, we'll be fine.
Any questions on the budget review?
Thank you.
Thank you very much.
Okay, thank you.
Okay,
Is this for the money or is that yours?
Nope, we have extra,
Okay.
and a goodie box too.
Oh, I don't need goodie boxes.
Are you sure?
Take it to your wife.
Oh, I can take it to my wife, I bet.
There you go.
Thank you. Wow.
That's a candy, right?
That's it.
Hands are ready. Thank you, Brad.
Thank you so much. I wish my grandkids were here.
There you go. Have a good day.
Okay.
Item number 13 is the meeting calendar approval for 2025. That's on page 24.
I'll make a motion.
I'll make a motion to
But
approve.
you know what, we need to make sure we update the website. That shows, I think the website says the third Thursday. So just double check the website to make sure that that is. I'll make a motion.
Okay.
Move December meeting.
Okay, I have a motion by Ann to approve the Thursday meeting schedule. Do I have a second? Okay. We have a second by Rosemary. All in favor? Oh, roll call.
Graig.
Yes.
Maggie.
Yes.
Rosemary.
Yes.
Ann.
Yes.
Thank you. Okay, district CEO report. Item.
Hey.
Did we approve, what's the name?
Treasurer's report, yes.
We did.
We
Yes.
did? Okay.
We did. Ann and Rosemary.
Okay.
Okay, so good evening, everyone. Happy Halloween to all of you. In front of you is a little treat from us to enjoy the Halloween. I want to thank Sophie and Yvonne and Adriana for helping put all this together. They're the ones behind all of the treats in there. So you've heard a little bit about this a little bit already. We visited the city of Soledad this month. As you can see from the front page of your packet, Greg and I, along with Giovanna LVN, Heather, Radiology, attended the city council meeting to receive a proclamation for the National Breast Cancer Awareness Month, which now hangs in the Women's Center. So if you go to the Women's Center, it's there hanging. We also participated, Greg and I, in the City of Soledad, Siempre Soledad General Plan for 2045, where we had an opportunity to share the importance of continued healthcare expansion in our community to meet the needs of the new housing development Miramonte coming in the next 20 years. What else? We hosted flu clinics. So if you guys recall, we received over 1,500 flu vaccines. Believe it or not, we've run out and we've ordered some more. Yes.
Good.
Oh, yes. It's amazing how many people have this year been interested in it. So we hosted 2 flu clinics with a plan to hold the third in November. The first was Friday, September 27th, where we vaccinated 61 of our residents and patients. And then the second one was Saturday, October the 5th, where we vaccinated 70 of our residents and patients.
Is the COVID included in that?
It wasn't this time, no. But if there is a request, remember, COVID at one time used to be free of no cost, and now comes at a cost. So it's up to folks, but it is available if needed. Also, Salinas Valley Health, on November 4th, I traveled to Salinas to meet with Dr. Alan Radner, CEO of Salinas Valley, and Kendra Howell, Director of Government Affairs from Salinas Valley Health. This is an effort to keep open lines of communication, collaboration, and partnership as we play a plan to stay in touch moving forward. And this is our way of continuing that collaboration in healthcare. As you guys know, there's not enough healthcare to go around, especially in these rural areas. And so we need all of the partnership and support that we can. And Salinas Valley Health is one of those partners in our community.
Is he coming down here, Dr. Radner?
It's been years, he said, but he's actually visited our site. I did invite him to come down here, and he certainly is up and open to that. No set date though, as of now. Also, I was privileged to speak at Empower, which is a nonprofit that has been hosting luncheons since 2008, bringing, motivating, and engaging speakers to engage our community. In the month of October, I was a keynote speaker with nearly 300 women who attended, who got to hear my uplifting and motivational speech to become CEO.
Congratulations on that. That was a big honor.
It was a wonderful event. Thank you. You heard from Adriana, Sonia de la Rosa, Community Administrator Officer, County of Monterey. I had already met with her, and this was a follow-up. I met with her in September. At that moment, I invited her to come see our district and see what we're about, the good that we do. She accepted my invitation and came here and took a tour, which was she was highly impressed. She got to meet our staff, she got to see our facilities and hear about all the vital services that we provide in our district. She would like to keep in touch and continue hearing about the good work that we're doing here in our district. So I will certainly do that with her as well. Leadership Academy. You know, I'm very proud of our district to have this kind of development and training. This was an academy that we started last year. And last year it focused on our leadership and our managers. This time it's focused on everyone else in our leadership, and I'll explain in a little bit. So in September 27th was our first session of 8, a professional and leadership development academy focusing on customer service. During each module, staff learns the tips, tools, and techniques that contribute to successful interactions with district clients, ensuring effective customer service, care, and satisfaction. This month's session focused on effective communication, where they discussed key elements of effective communication and strategies for communicating with both internal and external customers. They had group exercises followed by role-play scenario to practice effectively communication and listening skills with both internal and external customers. They were given homework to apply one tool. One tool they learned during the session over the course of the month until they meet again. This is offered to a cross-section of team members, 12 of them, from the clinic, Eden Valley, and Women's Center. So for example, we have the clinic front office folks who attend, clinic referrals team who attends, Eden Valley front office, the admissions coordinator, Eden Valley, the activities assistant from Eden, our maintenance, one of our maintenance team, our medical assistants, our x-ray tech, our dietary cook, and social services. It is a 2-hour session occurring once a month, which presents a different topic each month, and next month will be managing conflict. Monterey County Gives. We are just launched our Monterey County Gives champion, is that how you would call it?
It's a fundraiser, but this week is the challenge gift portion of that. So as you are aware, we are working towards finding funding for the mobile clinic, and this is one of the ways that we are trying to offset that cost by reaching out to our community to make sure that they support us as well as we work towards finding the resources.
So the challenge gift, we have till next week, Thursday, Halloween, to raise at least $500. This can be collectively, this can be one person, so that we can get put into the mix of all the other donors that MC Gift has so that they can donate back to us. So Adriana has these, if anybody is welcome, they're welcome to this, and this is a challenge gift form. Let's see, public records requests. We are working on 2 public records requests that we received, and so I just wanted to make you guys aware. One public records request was for employee salaries for 2023 with names, so we just submitted that. And then the second one is a request for electronic copy of all payment transactions for the district for 2023 and 2022 and 2023. We are working on that one. That one's a little bit more difficult because we don't have a system in place to support that. We're trying to figure out the best way to do that so that we can satisfy the request, but what we do have to also keep in mind and protect is HIPAA, because some of the refunds that are sent are customer refunds. So I just wanted to make you guys aware that we are working on these, and these are tech deadlines that we all have to meet, typically within 10 days, business days. Capital improvements, as you guys know, we continue to make computer capital improvements. I have another 5 computers for the core that will be dispersed within the next couple of weeks, which will replace the existing old computers that are anywhere from 5 to 10 years old. We continue to do that as well. So that will happen. Eden Valley, in your packet is a room rate increase letter, and this is an annual review. And we actually had 2 versions of the letter, and that was because can you call please? That was because there was an existing patient that we grandfathered to allow them, because they had been here for a long time, not to jump so quickly into the new rates. And unfortunately, that patient is no longer with us, and so the existing one is no longer applicable. So the only one that is applicable is the rate increase for anyone new, which is effective 1/1/2025. This notice will be in all of our packets and will go out to patients. So the rate, and we did some homework. I worked with our billing department to do some research for us, and we are actually one of the lowest around. So our daily rate increase will be $450 per day for a 2-bed and $480 per day for a single bed. And right now, we only have one room with a single bed.
So if there's new admissions between now and January 1, we want to make sure that they're aware that it will increase in January
Yeah.
for those admissions. And
Yeah.
what's the rate that state Medi-Cal pays?
And I did ask that question. I think it's around the 480s right now.
How much?
480?
Well, we have to bill the private sector more than Medi-Cal. And
I may be wrong. I'll have to get you the number.
I thought it was like $390 Medi-Cal.
Yeah, I don't have
I think
the.
it's $390 or $410, it's something like
I
that.
did ask that question earlier today in anticipation it was going to be yes. Let me see if I have an answer. I don't have the top of mind, but I'll get that to you. But it's always lower than, pardon me, we are always higher than that.
That cash price has to be higher than
Correct.
Medi-Cal.
I have a question. A family member is in a rest home in Morgan Hill, and every single thing that happens, he has to pay extra for. Do we do that here? I mean, like, if somebody brings you your pills, he has to pay extra for that. If somebody brings the dinner up for him from the cafeteria, he has to pay extra for them bringing it up to you.
Yeah, I mean, I don't know what kind of facility it is. Sometimes they're private, and that's if
It's
they're
a private.
if they're private, then they can kind of set their prices.
But do we do that here?
No, I mean, we have set prices for like laundry and certain things like that. That is correct. But under certain insurance plans, there's already a contracted amount, and you can't go above or beyond that. So it's all inclusive of medication, transportation, their meals, their room and board. It's all inclusive. Yeah. So I can't speak to that, but I'm assuming maybe it's a private, something more private. Okay. So these will go in effect January 1st.
How will that be in terms? I thought I heard something. How will that compare with other facilities you said were one of the lowest? Will that bring us?
Not really. I mean, again, you know, so you think about our mission, vision,
Understood. I just
Yeah.
wondered where we were. That was
it's still the same.
all. Okay.
I mean, I can certainly push it up to, but I don't believe that's been our goal.
No.
Our goal is to be accessible and available for the people that we serve.
Not a problem. I would
Yeah.
concur with that, but I think that's something that we should also let
Always
people
keep
know.
in mind, yeah.
Yeah, that, because people could say it's an awful lot, but it's not an awful lot compared to what other
Other
facilities.
facility, and a beautiful facility that we
Yeah.
have.
And that was the point, that was where that was going. I wasn't trying to get you.
No, I just want to give you guys some feedback. No, I didn't think so. Well, I did allude to this already earlier, but we did have some passings of some of our residents and long-term residents, so I did want to make you aware there is a plan to have, you know, some memorial service and give a place for not
Oh,
only
good.
not only for the families, but for, you know, for our staff
That's good.
who becomes bonded with them and so close to them. So I did want to share that as well. Star ratings. So this has been kind of a topic that we've addressed at a couple of the meetings. So I went back and I did some history. Did some review. Fortunate and unfortunate. The unfortunate is that the data that was being submitted to the agency that keeps track of our star ratings, it wasn't going over there entirely. What does that mean? So when you look at nursing, we actually had the suitable nursing. But because the data didn't transfer over, it didn't get recorded properly.
Whose responsibility was that?
So it goes through several departments, and the last department, it goes through our payroll department.
And how will it be corrected?
We have an opening to make any corrections for this year and this scope and this quarter. But what we're hoping to do, Ann, is to go back a year because we think that it, because our stars started declining and it just didn't make sense, and that's why the research was done. And so I'll give you a prime example. In this second quarter, it was reported that we did not have a suitable, adequate level of nursing staff for 39 days. After my research, it actually turns out at this moment that it was only 6 days. Big difference.
Yeah, it's
Big difference. And within policy, I'm still confirming it, but within policy, they do give you some flexibility. Secondly, if there was any waivers at the moment. And so we're confirming, I think Susan has alluded to, there might have been some waivers, nursing, and if there's waivers, then that will apply as well. So just know that I understand that our stars look the way that they do, but that may not be, it is not a true reflection of what we have.
Well, the important thing is to get it changed because a
We're
lot of
working.
people look at that.
Yeah.
And
So
that
that-
might be something for public relations.
Yeah,
And it might also be something to meet with the staff as a whole and explain that to them.
yeah, we've had several meetings since this discovery.
Okay, good.
And so on the staffing, when you look at the model, right, your overall for September is a 2, but when you look at the health inspection, we got a 3, quality, we got a 4, staffing, we got a 1. That's your biggest. So what happens every quarter, we get like a rinse and repeat, and we get to fix that, but it does take time for it to manifest in the whole overall quality rating. But just know that our goal is by next week we will submit our reports to show them our new data.
Okay. Let's make sure we bring that up at the next meeting.
Absolutely, I'll give you guys. We'll make sure to give an update. Okay. What else is there? So we do have some new hires that we've added. And so just to add a little bit more to that, we've hired close to, or if not, 6 RNs. So that tells you our commitment to making sure that this is happening. So we don't like that.
Did the new speech therapists come in?
They're all here. Oh, no,
Just speech, yeah.
that's happening in the next month. If all goes well. So new hires, so we hired 2 CNAs with a 3rd to start next week. And then we hired a return employee, Edgardo Cebellino, and he's an LVN. And I also want to share, Adriana is working on a report or a press release on many returning individuals, including our director of nursing, who was here many years, who is now, she was an LVN and an assistant director of nursing, and will now come back as our director of nursing. She starts on Monday.
Oh, wow.
Yep. We also had years of service. So Lali and Coda in our dietary, 1 year of service. Jerry, Paula Rollins, a mammography coordinator, 1 year of service. So we had some anniversaries as well. Census, Susan will talk more about this. Currently we are at 45, 9 Medicare, 4 managed, 0 private, 32 Medi-Cal, 0 bed hold, 0 hospice. We're at a 76%.
Actually, we have one hospice.
We have 1. Let's see. Clinic. I'll let Susan maybe continue with Eden, and then I'll come back to clinic if that's okay with everyone.
Yes.
Okay, good evening, everyone. Okay, so for our report for the month of September, Our average daily census has kind of steadied around the 45 percentile. So for September, we had 46, our average is 48. Year to date, we've been maintaining 49 in regards to our average daily census. Occupancy for September is 79%, average is 82, and year to date is at 82. For admissions in September, we had 10. Our average is 15, and year to date, we have 142 admissions. For discharges, we had 14. Our average discharge is 16, and year to date, we had 144 discharges. For our skills mix, in September, we had 10 Medicare, 33 Medi-Cal, 2 HMO, and 1 private pay. All of our referral sources continue to be strongly from Salinas Hospital, and then 1 from CHOMP. We have 1 resident or candidate for our wait list. And then going to CDPH and Regulatory Affairs, we had 0 deficiencies. We had 2 self-reports. 1 was allegations of abuse with staff, and CDPH hasn't visited us on that yet, so we don't know what the pending outcome will be. The second incident report that we reported to CDPH is, again, allegations of abuse versus staff, and that one also is pending. For operations, Ida has touched on our current status in regards to our star rating. I anticipate it will improve once we get all of the correct data inputted to CMS. So the average might definitely go up a little bit by the information. We had several committees that we had for the month of September. One is our QAPI. So far, everything that we've done in regards to our plan of corrections from all of the ones back in 2023 has been 100%. We are closing more of those with our audits being 100% in compliance. For safety, we had 0 injuries. For pharmacy, our representative has said that we are maintaining 100% compliance in regards to our pharmacy. We actually reduced our falls in September, so we actually had 6 falls. We continue to use our fall management program. We have a fall committee. We're using our falling star. We're looking at all the clinical assessments and opportunities, as well as working with our pharmacy to look at the different types of medication that may impact or affect those falls. We also added, I didn't put it in here, but we did add a new committee that was, it actually was initiated because of our recent COVID outbreak that we had. So we established a COVID committee, and anticipating what our next season will be with flu and pneumonia and RSV, we feel that this committee will be very beneficial. That includes all of our healthcare partners, including Dr. Pham, to identify and mitigate, as well as if something does happen, how to control it, using our policies that we have in place or establishing new policies if necessary. Excuse me. For other, we did meet with our Soledad Community Center to look at different types of marketing and collaborations with health programs. I visited the Salinas senior community and toured them as well, and looking at health partnerships in programs. We visited Freedom Transportation and did a tour. They also have one of their ambulance here, and we are going to be considered a priority for them if there is any type of an emergency versus just waiting. And then I also visited CVS IMAS in Soledad and tried to look at allowing us to put brochures there for any potential recipients who might need it or someone who may know that they need it. So I will be continuing to work with our direct collaborators and referrals, which is, again, hospitals, case managers, and trying to continue to promote our community out there if and when they need us. So that's my report.
Question.
Yes.
You had said that the average daily attendance was 46 to 48%, somewhere there. And yet, the census is at 79%. Why is there such a big discrepancy? Because, I mean, explain to me what the average daily, does that mean that there's 46% occupancy?
Occupancy is 79 just for September only. And so, and then for our average daily census, it's like based upon a 30-day, how many people go in, how many people go out, but how many do we count in bed after midnight? And so that is what we go by
Oh, I
for
see
our
what you mean.
insurance.
Okay.
And that's how they bill, especially Medicare. If you're not in that bed, if you're out at the hospital on observation, it doesn't count.
Got it, okay. Thank you.
Just a question, the ambulance that you were referring to, that's up
Yes,
here.
Greg?
When you said if something happens here, so I'm assuming that means if we had an active shooter or something like that, is that what you're referring to?
Yes.
Okay,
We want to be the first choice in regards to getting care or service or support. When we have a contract in place as part of our emergency plan, they choose us and provide care for us first versus someone just calling them because we have a committed contract with them.
fantastic, that's great, that's super fantastic.
Like our school, our churches that are nearby.
That's super fantastic, thank you.
So it's a great partnership in our own. Any other questions?
Okay. Thank you very much,
Okay,
Susan.
thank you.
Thank you.
Have a good evening, everyone.
Okay, before I move on, I did want to share with you guys, I know we talked a little bit about this last time. Susan did talk about citations, and there was one back from 2023 that we just had to pay. It was from February 23. So we contacted the agency, which is CMS, which is the Medicare, which is what you see when they say that there's a fine. We actually were able to get that reduced by a significant amount. I mean, although it's still a significant amount we paid, we didn't have to pay the full amount. So instead of the original amount, which was nearly 53,000, we had to pay 34. And this was the incident of the nurse and the cardio situation that we had.
Who does that money go to?
To them, to the agency, to the CMS.
Medicare.
Yeah, they're compliance folks. So I did want to share that as well. So moving on in the clinic, we did have, I did already explain, we had 1 year anniversary there. We did also have a resignation of a provider. The good news is that we've hired another provider, a PA that's supposed to start next week or a week after that. So that we can keep things,
Let's bring in some of these providers so that we can put a name and a face together.
Absolutely, I'll invite them to join us once they're here. We really haven't had change in a while, so that would be the only one, but we can certainly do that. What else? The clinic, I've already shared this with you guys earlier today on the Medicare. We were able to complete that certification for the Medicare, and so we will be getting those claims out and billed. Also, we have each annual year, we have to do, actually every 2 years, we have to complete, there's many certifications that have to happen of our modalities, meaning like x-ray and ultrasound. So our now that we have mammography, that is also needs to be completed. So we have what our mammography certifications are all complete. It's the x-ray portion that's not complete. And in order to complete that, we have to pay a fee, in essence. We decided, for the sake of insurance purposes, we don't want to not have the certification and then insurance comes back and says, hey, you didn't have that, and then we have to pay back. So we've decided to postpone at this moment. We do have a waiting list. We should expect to receive this within the next couple weeks, and once we do, then we'll resume as normal. They changed their process, and that's what caused the delay. They no longer sent you anything in paper. It all has to happen electronically. So that has been now taken care of. We're just now waiting for the actual certification. What else? So each quarter, the California-based incentive program with CCAH gets reviewed. In quarter 3, they went back and reviewed our metrics. And based on our metrics, out of the 9 different metrics they look at, breast cancer screening, cervical cancer screening, child and adolescent, well care visits for ages 3 to 21, depression in adolescent and adults, diabetic, HbA1c, control, immunization of adolescents, immunization of children, lead screening, and well child visits. We scored, if not meets, excels, or exceeds. There's one area, and we've worked on that to improve it. We are at 56.62%, which is right at almost the 50 percentile. The 50 percentile was 58.38, and that's really where we want to be. So some great stuff happening there. And if we keep that trajectory, it's estimated that we will receive nearly $300,000 from that program, which we kind of a little underestimated because we weren't sure what it would be in our budget. What else is there? I think that is it. Thank you always again for your support and your leadership. And
Question.
yes, go right ahead.
We haven't gotten a foundation report in a while. What's going on with the foundation?
Yeah. Right now, they're in the middle of their MC Gifts campaign, and then they're about to launch their, and maybe Rosemary, you might want to, but add to that, they're about to launch their Gift a Light campaign. Yep, and their Gift a Light, this year they decided to continue to focus on the beds because they have contributed to buy, it's been, I think, 9 beds so far, and they want to continue on buying beds for our residents.
Maybe we could get it on a monthly basis, update on what the foundation is doing.
Rosemary, maybe
You
can.
know, just to know what's going on.
Sure.
Okay,
That's all I have. Thank you.
that's all I have.
We'll adjourn, go into closed session.